Hello everyone, welcome back to my channel. Now today's presentation is part 1 of nursing practice questions and answers about fluids and electrolytes. Now let's start with the first question. The nurse is caring for a client with heart failure. On assessment, the nurse notes that the client is dysphenic and crackles are audible on auscultation. What additional manifestations would the nurse expect to note in this client if excess fluid volume is present? So these are the options. Option A, weight loss and dry skin. Option B, flat neck and hand veins and decreased urinary output. Option C, an increase in blood pressure and increased respirations. Option D, weakness and decreased central venous pressure, CVP. So the correct answer for this question is option C, an increase in blood pressure and increased respirations. Now let's move to the rationale. A fluid volume excess is also known as overhydration or fluid overload and occurs when fluid intake or fluid retention exceed the fluid needs of the body. Assessment findings associated with the fluid volume excess include cough, dyspnea, crackles, tachypnea, tachycardia, elevated blood pressure, bounding pulse, elevated CVP, weight gain, edema, neck and hand vein distension, altered level of consciousness, and decreased hematocrit. Dry skin, flat neck and hand veins, decreased urinary output, and decreased CVP are noted in fluid volume deficit. Finally, weakness can be present in either fluid volume excess or deficit. Now let's move to the second question. The nurse reviews a client's record and determines that the client is at risk for developing a potassium deficit if which situation is documented. So these are the options. Option A, sustained tissue damage. Option B, requires nasogastric sanctioning. Option C, has a history of Addison's disease. Option D, uric acid level of 9.4. The correct answer for this question is option B, requires nasogastric sanctioning. Now let's move to the rationale. The normal serum potassium level is 3.5 to 5.0. A potassium deficit is known as hypokalemia. Potassium-rich gastrointestinal fluids are lost through gastrointestinal sanctioning, placing the client at risk for hypokalemia. The client with the tissue damage or Addison's disease and the client with hyperuricemia are at risk for hyperkalemia. Finally, the normal uric acid level ranges from 2.7 to 8.5. Now let's move to the third question. The nurse reviews a client's electrolyte laboratory report and notes that the potassium level is 2.5. Which patterns would the nurse watch for on the ECG as a result of the laboratory value? So select all that apply. So these are the options. Option A, U waves. Option B, absent P waves. Option C, inverted T waves. Option D, depressed ST segment. Option E, widen QRS. complex. So the correct answer for this question is options A, U waves, option C, inverted T waves, and option D, depressed ST segment. Now let's move to the rationale. The normal serum potassium level is 3.5 to 5.0. A serum potassium level lower than 3.5 indicates hypokalemia. Potassium deficit is an electrolyte imbalance that can be potentially life-threatening. Electrocardiographic changes include shallow, flat, or inverted T waves, ST segment depression, and prominent U waves. Absent P waves are not a characteristic of hypokalemia, but may be noted in a clan with atrial fibrillation, junctional rhythms, or ventricular rhythms. Finally, a widened QRS complex may be noted in hyperkalemia. Now let's move to the fourth question. Potassium chloride intravenously is prescribed for a client with heart failure experiencing hypokalemia. Which actions would the nurse take to plan for preparation and administration of the potassium? So select all that apply. Option A, obtain an intravenous infusion pump. Option B, monitor urine output during administration. Option C, prepare the medication for bolus administration. Option D, monitor the IV site for signs of infiltration or phlebitis. Option E, ensure that the medication is diluted in the appropriate volume of fluid. Option F, ensure that the bag is labeled with the volume of potassium in the solution. So the correct answer for this question is options A, obtain an intravenous infusion pump. Option B, monitor urine output during administration. Option D, monitor the IV site for signs of infiltration or phlebitis. Option E, ensure that the medication is diluted in the appropriate volume of fluid. And finally, option F, ensure that the bag is labeled with the volume of potassium in the solution. Now let's move to the rationale. Potassium chloride administered intravenously must always be diluted in IV fluid and infused via an infusion pump. Potassium chloride is never given by IV push. Giving potassium chloride by IV push can result in cardiac arrest. So the nurse should ensure that the potassium is diluted in the appropriate amount of fluid. The IV bag containing the potassium chloride is always labeled with the volume of potassium it contains. The IV site is monitored closely because potassium chloride is irritating to the veins and there's risk of phlebitis. In addition, the nurse needs to monitor for infiltration. Finally, the nurse monitors urine output during administration and contacts the physician if the urinary output is less than 30 ml per hour. My reference book have used Saunders Comprehensive Review for the NCLEX-RN examination 9th edition. So please promote my channel by subscribing. Thank you. Have a good day. Let's meet in my next presentation.